This is a movie about a group of medications called statins. Are they good or are they bad for us? My good friend Simva will try and help us understand.
Statins are a drug that help lower your cholesterol. Newspapers, like the Daily Express, tell me lots of different things about statins. I have to take this medication on a daily basis. And I want to know if this medication is actually any good for me. I'm going to try and understand the real truth about this medication. Over the years, the Daily Express has published articles like these saying statins are great for us as they can reduce the risk of heart attacks. That's good news, isn't it? But then I read it could give me a nasty, itchy, red rash on my arms and legs. But it's okay because statins have slashed the risk of me having a heart attack by 30%. Wow! Just when I thought statins were good for me, I read that some doctors are advising me to stop taking my medication as it could cause me to be really ill. There's a whole list of illnesses like headaches, constipation, dizziness, diarrhea, pins and needles, chest pain, difficulty sleeping, sexual problems, hair loss, wind, forgetfulness and forgetfulness. I think I must already be suffering with symptoms. Statins can also cause some really serious illnesses like acute kidney failure, liver dysfunction, cataracts and muscle weakness that can leave people in wheelchairs. Statins must be good really if doctors are giving it to people even before they're taken ill. Oh no, I definitely don't need diabetes on top of all the other side effects. I'm worried about these statins. I don't want to be ill. On the other hand, I love chicken burgers, and the Daily Express said they'd be giving them away with the statins. The most recent articles have all been positive about statins. One article even suggests we should increase our dosages, as it is a wonder drug and can reduce risk of heart attacks another 15%. I don't know about you, but I am none the wiser after reading those articles. You know, the Daily Express even confused themselves at one stage, publishing an article, "Are statins to blame?" If the people writing the stories don't know the truth, how are we supposed to find out? I'm so confused. Is it better to take the medication but suffer all those nasty side effects? Or stop taking it and I might have a heart attack or a stroke sooner? And I don't mean a stroke that makes me purr, I mean one that leaves me without speech and dribbling. Right, instead of all these junk tablets, I've been doing my research so we can find out the truth about statins. Are they good or are they bad for us? Clinical studies to approve a drug and test their side effects in a selected population usually do it over a relatively short period of time. The NHS website told me that. The study that helps us understand the truth about statins was carried out by researchers from Nottingham University. These researchers carried out a prospective cohort study investigating the side effects of statins. So this means they studied 2 million patients from 368 GP practices across England and Wales. They studied over a long period of time a large cohort of patients, both users and non-users of statins, which allowed long-term side effects to be revealed. So what did this study actually tell us? Well, it did tell us that the side effects reported in the newspapers we read earlier were correct. What the newspapers failed to tell us was that these side effects are rare. The study found out that less than 3% of the 2 million people tested contracted cataracts, and 1% of the study population contracted the other serious side effects, mainly liver dysfunction, acute renal failure and muscle weakness. It is also necessary to point out that Nottingham University received no external funding for this study, and it was published in a peer-reviewed British medical journal. So I have learned that it's fine to read newspapers like the Daily Express if you want, but always do your own research. Now I can make an informed decision to stay on my medication, but I will go and visit my GP and discuss the symptoms I've been having. Oh, sorry about that.